So this is the hip abduction with lateral rotation with the hip flex. It's a lot of words. It's really just the Faber test. And Sauerman talks about the foot that you're testing being on the table or the plinth. I mean, we've taught it to you where you can put the foot on the knee as well. I'm okay with you doing it both ways. Okay? The idea is we're seeing, can she flex her hip, laterally rotate and abduct? And we talk about 50 to 60 degrees. So as she's up in this position, this would be 0. All the way flat to the table would be 90. So if we go about halfway, you know that's about 45. So we want 50 to 60 roughly of hip abduction, lateral rotation, and flexion without pelvis rotation. Okay, so I'll show you this one. So this is, again, I'm just putting the foot down on the table. I'm monitoring the contralateral ASIS because I want to see when it starts to lift up into my finger, if it does. So we're going to let her knee just kind of fall out. I'm going to show her what I want her to do, and then we're coming back down. So this is the starting position, and then this is probably about that 50, and I could go quite a bit further. So I'd say she's okay there, and then you can have her do it actively. Again, most tests I'm going to do actively and then passively, but a lot of times if the patient doesn't know what to do, you have to show them. So you passively show them, have them actively do it, and then you can recheck it passively. Okay? And then the variation is you can just put the foot, you okay there? You can just put the foot on the knee, and then you can let it drop down as well. Now the foot on the knee is probably going to give you less motion than if your foot's on the ground, because your foot can move a little bit easier on the ground. Okay? So again, we're checking for pelvic rotation. Let's say she stops here, I can't go any further, so she stops right here, and her pelvis starts to rotate. A couple things we're thinking. One, the abs are not doing their job to maintain that pelvis in a good position. Two, the hip adductors could be short or stiff, not allowing her to move any further. So then her lumbar spine is more flexible than her hip. So the lumbar spine gives and her pelvis rotates. So that's the hip abduction and lateral rotation in hip flexion, or the Faber test.